This is a really interesting case of vitrectomy to repair a retinal detachment that has what's called a giant retinal tear. You can see the vitrectomy being performed in my left hand is the vitrectomy cutter, and underneath that is an elevated retina, and you can see a very bullous flap of retina there. That's a retina that is completely detached from the front of the eye, called the vitreous base. And I'm carefully removing the vitreous all around this tear, trying very hard not to injure the retina as I do so. You can see once I get enough vitreous out, I'll then use what's called a heavy liquid or perfluorocarbon to actually push the retina flat, because there's no other good way to get this large retinal flap to lie flat. You can see I even need to use my instruments to kind of uncurl this retina. So here I'm using a little silicone tip called a soft tip, and I just am gently pulling that fold out. You don't want to leave a fold in the retina if you can help it. That's sort of asking for scar tissue to form. Once I get it completely flat, I then use this flexible laser, and I'm going to laser 360 degrees in the far periphery of this patient. I'm going to put laser very carefully around where that tear was, that what we call a tangential tear. Get a good 2 to 3 rows. Once I get sufficient laser, I'm going to remove all the fluid from the eye so the eye is filled with air, and I'm using that same soft tip to sort of gently remove the fluid where that tangential tear is. Then I go over the optic nerve and remove residual fluid. After the fluid is completely removed, I'm going to put in silicone oil, which is a clear oil that a patient can actually see through, and it holds the retina in place until the laser can heal, which is about 2 weeks, but we typically leave oil in for a couple of months at least. And that's a case of a vitrectomy for a giant retinal tear. Thank you.